So, good morning, my people. Good morning, Bendoma. Okawa Kebu Kebu TV on the MIC. And today is Thursday, the 10th day of April 2025. So, I now report from ITC. Yes. International Conference Center, yeah, where we are expecting the arrival of the former president of Nigeria, Chief Olusegun Obasanjo. Now, very all important event bordering on health, emergency health insurance, urgency, and also official flag off and ceremony of the Abia State free medical outreach. So, and on an international conference center, so you can see the red carpet is also ready and dignitaries are also arriving gradually. Now it's the veteran. So we'll also be giving you situation updates as regards to what will be taking place today. So stay tuned on KBKB TV. Amen.
Are there particular illnesses that the insurance does not cover?
Well, there's a benefit package. In all insurance, there's what they call premium. The premium determines the benefit package, or the benefit package determines the premium. So, of course, there are things that might not be covered under a social health insurance scheme. So it's not, but what we have is so robust that it covers almost all the programs, all the health insurance, all the illnesses that most of our people suffer.
Like I understand that the insurance package, what does it cover per servant in the state? Who are the beneficiary in there?
Okay, as a civil servant, it covers the civil servant, that's the principal, and the spouse, and 4 biological children. They're all covered, they have the same access. And the good thing is, it's a social health insurance where the rich will support the poor and the weak is supported by the strong. What do I mean? Whether you're a driver in the civil service or you're a permanent secretary, you have access to the same quality service that is expected in every hospital.
Okay. Do we have a particular hospital? Assuming now my son is sick or my child is sick, is there a particular hospital that I must go to for me to be able to access it?
Well, they are accredited hospitals. You are not limited to any particular hospital. We are using both public and private hospitals. They are accredited by us to make sure that they can give us the quality service we require. So as a civil servant, you have the opportunity to choose from any of those accredited hospitals, be it public or private.
Thank you very much.
Okay, I'm Dr. Olakwema Oke. I'm the Director General, Abia State Agency for the Control of HIV/AIDS and SACA. However, in this occasion, I'm wearing a different cap as the coordinator of the Abia State-led free medical outreach mission, which is a mission that intends to take free healthcare in the Abia close to their community. So after today, by tomorrow, we're going to Abba South local government area. We will actually be at Abba General Hospital to give free medical care that benefit the people of Abba South. Thereafter, we intend to cover the remaining 17 local government areas before the end of 1 year.
To cover the 17 local, you
Yes.
mean to be going to
From one local government area to another, giving free health care. To start with, we're going to teach Abians about good living, good nutrition, avoidance of substance abuse, and everything they need to do to be healthy, because a healthy state is a productive state. In those medical missions, we'll provide eye care, we'll provide reading glasses to people that need it. We'll also provide treatment for common ailments like malaria, typhoid. We'll also provide treatment for chronic non-communicable diseases like diabetes, hypertension, arthritis, and then the common infections, skin infections, and whatever might be the need. And in this outreach, we're going to come to them with very high quality medications that will be devoid of any adverse effects.
at a particular point, how many days are we expecting you to, let's say, at Basat now? How many days?
In each local government, we will try to spend 3 days.
All right.
However, tomorrow's zone, since it's just a start-off, we started today here and we're in Abasa tomorrow. There are other activities. Week is already gone, but the plan is to spend at least 3 days and in more than one location to capture the geographic spread of that local government area. So if we go to Ohafia, we will be consulting in 3 different locations at the same time.
All right, you know, for teachers, they will talk about objective or aim. What exactly do you intend to achieve at the end of the
Health conscious, healthier Abians. And those who have the chronic ailments will have referrals so that they don't get to have complications of those chronic ailments. We know that some of the renal failures, that kidney failure we have now is because of poorly treated diabetes and hypertension. So, and many people who are suffering from these ailments do not even know that they have them. So with this, we're going to help people know what their health status is and get all the care so that they're not found at the point where the complications, when it is too late, when the complications have set in. The eye care also will identify people with things like glaucoma, which is a silent thief of sight, so that Abians do not just suddenly go blind. And generally, the objective is just to have healthcare that is accessible, since we're going closer to the communities, healthcare of good quality, healthcare, they are not paying, so let me not say affordable. So it provides some level of equity, irrespective of your financial status. You can get healthcare that is sponsored by the Abia State government. We cannot appreciate our governor, His Excellency Dr. Alex Oti, OFR, and North for this. We already started there. I don't know if you have seen the booths and what is happening there. Many Abians are already benefiting from this that is happening today.
Is it going to be a continuous?
So still on the screening and also treatment, these are some of the people that are going through one treatment here, and also so many things that are passing through one illness or the other. They are being treated, they are being taken care of. Courtesy of this very event, the Ghana baby flag off today. So I know Abraham. So two of them are from ear, people that are having ear issues and also eye and so many other things. So this is actually what is happening now ICC Center, which will be fully be flagged up today as we await the arrival of His Excellency with his entourage alongside with the former President of Nigeria, Chief Olusegun Obasanjo. So we are reporting live from the ICC Center, International Conference Center, Umuahia, Ogurube. So these are the area where the event will also be taking place. As you can see, everything is all getting set for the full event that will happen today. So don't worry, a lot of ways this government is impacting life in a special way. Yes, sound intervention, hearing mission 2025, and so many other things. Official flag off ceremony of the Abia State-led free medical outreach. So, right away. So, people are coming irrespective in whole and achọghị ịma ma iwu onye Abia ma iwu onye Enugu ma iwu onye Imo ma iwu onye Wawa ebe ọbụla si na-abịa. Their duty is just to make sure that they impact life and also impact life positively. So onye ga-abịa akabere nye unu situation updates otu o si na-eme na ogbe today. So keep following Kebukebu TV for more information, for more gigs and also more news. How are you? She's fine. Actually, the patient is very, very happy receiving your free medical care. He's very, very excited. to sail on it. So we are still doing our best.
Is Kennedy Asoso. I'm the Southeast coordinator of the foundation, the Olusegun Obasanjo Foundation.
Okay, what is foundation here doing Abia today?
Okay, we are here for a sound mission for the hearing people, people that are having hearing impairment, because we believe that they don't have access to good life. They are having a kind of loss of their hearing senses. So our founder has a very special interest for people that have hearing impairment. And here in Abia State today, we are here to represent the Southeast because all our programs has been in the six geopolitical zones of Nigeria. We just finished Southwest sometime January, so we are here in Abia State for Southeast. So hopefully after Southeast, we'll be going to South South for the hearing mission. So it's across the country.
All right. And now, how many persons are we expected to receive the aid?
Yes, we are expecting to give about 2,000 hearing aids to people that have hearing impairment in Abia State.
So what is the cost for the equipment by
Yes.
beneficiary?
Okay, per hearing aid is cost about 1.8 million naira, and it's being given for free of charge to every patient here. Free of charge. You don't pay a dime for it.
Okay, what does it help to? Can you explain? Let's say for people who are there from, they help with it.
Definitely, yes. Because the hearing impairment is in degrees. Some people don't hear properly, some don't hear at all. Some persons lost their hearing senses from birth. Some people old age, some people has infection, some people they lost their tooth. And then when you come for the screening, we have to screen you. Then we have to also do otoscopy, as you can see, it's going on here. Otoscopy to know the injury in the ear and to determine the kind of hearing aid we give you. Because we have different kinds of hearing aid. We have type 1, type 2, and type 3. So definitely here in Abia State, when they screen you, can determine the kind of hearing aid we give you. And of course, definitely, once you don't hear properly or you don't hear at all, if you have the device in your ear, definitely you start hearing. And we've seen testimonies here on ground that people that lost senses and they came here and they started hearing again. Yeah. All right. Thank you very much. Thank you very much.
This is the process. The treatment is still ongoing, so you can see the way they have been explained to them before they receive the medications and also the device. So see that the International Conference Center ICC will do Maya. Different people, different individual, one issue or the other, they all come around to receive free medical care courtesy of this very program that will be flagged up any moment from now. So we are attending to them free of charge, both children, adults, mothers, and also even infants. Yeah, so you can see the process. What they say, using His Excellency Dr. Nestor to impact lives positively in a special way. You can see people that have one issue or the other being attended to. What else are we talking about? What else do you even want in this life than when you are in the corridor of power, be able to impact life positively, be able to assist the less privileged, you know, to other hand, whether by maybe subsidizing some of this treatment and also giving them free treatments from them. So this is actually what is happening here today. People want an eye issue, people don't want an ear issue, and so many illness is being attended to. So that is actually what is happening at this international conference center. That is why the former president of Nigeria, Chief Olusegun Obasanjo, is coming to address for the full flag off So we will also be showing you more on this side, so stay tuned.
My name is Emenike Amagwe.
So, do you hear often?
Sometimes I do. Sometimes I hear sound, but when people speak, he can't catch it truly or understand it clearly.
So, do you often go to clinic to check what is the problem with your ear?
No, 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 no. I don't.
So, why haven't you been able to go to the clinic to check your ear?
Honestly speaking, in the past, when he was a little boy, his parents normally take him to visit the different hospitals. They examine his ears, examine, treat him. Still doesn't work. Until now, he can now manage his ear. Maybe the parents trained him on how to, lip read, watch tongue, watch lips talking, and he's helping him to improve better. Even the family, in the parents' home, they will equally tell him something to understand it, communication. But if it's in the others, that's people around, he can't catch them. Mother tongue helps children to grow. So, but others speak, he can't get them.
So, what have been the most difficult challenge you have faced because of this hearing issue?
To face because of hearing problem. My most challenge is I can't hear. Very difficult. I can't hear big noises. Only the time it's raining, thunderstorm, I can hear that one. But when people are quarreling what is happening outside or whatever, I always use my eyes to sight it, but I don't understand what is happening. That's my most challenge.
Any other Obasanjo Foundation has come to your aid so that you can be hearing?
Of a truth, I'm very excited to see, but this is not his first time of doing it. He has done it before, and this is the second time he is doing it. Abia State and Southeast, we are very happy. We welcome him. We thank him also for supporting us. We also thank our governor too for his. I believe that Abia will appreciate them so well. Also, I will beg him to continue in other southeast, but in the southwest, south north. I know that they are also doing that as they are doing to Abia State. We thank Obasanjo so much.
Thank you very much.
Thank you very much.